Necessity is the mother of all inventions. And the COVID crisis, literally shocked the world. We all had health systems that were overwhelmed. We had supply chains that were interrupted. And we had people that basically were dying because they couldn't get access to care. It didn't matter what your socioeconomic status was. It didn't matter what means were accessible or not. People were impacted either way across the board. And I think that for USAID within this context, especially in India, what we realized is that we have to channel the support that's needed. That the government of India is doing an incredible job of balancing the need to respond to an emergency situation, but also redoubling its own efforts in terms of Ayushman Bharat, the primary healthcare system, and even secondary and tertiary levels for critical response and care. They launched so many different programs, whether it was Ayushman Bharat infrastructure mission, the digital health mission, or even beyond. But what we realized is that unless we could harness the power of the collective and be able to also gather resources from multiple entities, including banks, foundations, donors, and the private sector, or even beyond that, just the intellectual capital that's needed to really think about structuring and forming an advisory board, of setting up, even a system for blended financing where grants and equity and, debt funding can all work together ultimately to be able to unlock market solutions to a crisis. So what we learned, at least the hard way, right, was that we could gather, multiple resources and multiple partners and actually align towards a shared vision and ultimately find solutions.